Rena, this person likely came into contact with the coronavirus while in Europe. The health department just got the positive presumptive test result back late this afternoon, and now they're trying to figure out everyone this person has been in contact with. The second presumptive positive case of coronavirus in Minnesota is a Carver County resident in their 50s who was on vacation in Europe late last month. On March 2nd, the person developed symptoms. On March 7th, the person sought medical help. Health officials are trying to learn who this patient has been in contact with during that 5-day gap.
What will be more of concern is whether the person was moving around the community between the time that they developed symptoms and sought care.
On Friday, officials announced the state's first presumptive positive case, an older Ramsey County resident who was exposed on a cruise ship. Symptoms of coronavirus include fever, cough, and shortness of breath. The breathing problems, Health Commissioner Jan Malcolm says, especially differentiates the illness from the flu.
If symptoms worsen, fever, and increasing respiratory difficulties.
The new patient is not hospitalized. They're isolated at home and recovering well. Because the health department does not have evidence of the coronavirus spreading in the community, Malcolm says it's too early to start canceling sporting events or other large gatherings. But she says it's important that they are thinking ahead.
We're very much thinking about what would trigger that and preparing and talking with community leaders to understand the implications of implementing decisions like that.
As of tonight, state health officials say they've tested 80 people and just 2 have been positive. Health officials say that it's important that we each do our part to stay healthy, and that means staying home when we're sick, covering coughs and sneezes, washing your hands frequently and well, and avoid touching your face throughout the day. Rena?
All right, lots of good information. Thank you, Lou.